awesome. You have an amazing event coming to California. Just tell me a little bit about that, because I want to get into some of the things you're covering there too.
Yeah, sure. So this is taking place on the 28th of October in San Jose Civic Center, Northern California. I'm speaking alongside Dr. Vandana Shiva, who's an environmentalist, has been very prolific, pointing out all of the shortcomings when it comes to what's going on with the food industry and agriculture. Dr. Drew Pinsky, who many people know as a household name in the
Yeah.
United States, is going to be moderating. And of course, my friend, who is also going to come and give his perspective and in many ways offer political solutions because we need them. Robert Kennedy Jr. is also going to be speaking, and we have some surprise guests as well, which I think is going to really startle the audience in a good way. But I don't want to give that away yet. And what the aim of that conference is called Reclaiming Food and Medicine, Dell, is multifold. But really what we want to do is get to the roots of the issue, why American healthcare system is failing, what's driving chronic disease, empower individuals both on a health perspective, but also, as I've said earlier, the system is broken, and we can't sit back and just expect the authorities now to sort the problem out. I think there needs to be an increasing grassroots movement, and we want to help individuals know what they can do to try and clean up this broken system and this mess that we're in, this medical misinformation mess, this health misinformation mess. We're fighting for the soul of medicine. And to paraphrase, Martin Luther King said in the 60s that, he was fighting to reclaim the soul of America from war, racism, and poverty. I think those issues are still outstanding, very much so. But we really want to focus on how we can help people to, lead the best possible lives they can mentally, socially, and physically. So we're covering quite a lot in that conference. I want it to be, certainly with everything I do, I always try and improve on what I've done before. And we're hoping that this conference will be certainly the best up-to-date health conference in the United States this year, potentially the world, I would like to say. And we're doing this, which is, not for profit. No one's making any money out of this. We're, fortunate to have a generous philanthropist from Australia called Adrian McRae, who has put the money down for the venue, which is a beautiful venue, San Jose Civic. I went to visit it recently, and I saw some amazing photographs of people that had actually performed there before, including the Rolling Stones and the Who. And I thought, wow, this is going to be, quite an interesting place to have this event. But it's a beautiful venue, and all ticket sales, of course, will make money back for Adrian, but anything excess is going to be given to charity. So this actually is an event that's giving back to society in more ways than one.
Here we are, folks, October 28th. It starts at noon. San Jose Civic Center for Events, tickets, Reclaim Food and Medicine is the bit.ly. I just very quickly, one of the things that I really love about this, and it is so true, our mission statement here at the Informed Consent Action Network, our nonprofit, is dedicated to eradicating man-made disease. That's not just pharmaceutical products. It's not just vaccines. It's also our food supply, which is something that I love that you're branching out. And in many ways, I think that the vaccine issue is the tip of the spear of issues that are out there, but it's the one that's the most vivid right now, and that we really saw, for those of us that were awake enough to witness what happened. We saw the sausage being made right in front of our eyes. We watched the regulatory agencies become cheerleaders for a product instead of being the skeptical science body they should have been, which is saying we're not going to rush this out until it proves to be effective and proves to be safe. You can count on that. Instead, before they were even into their trials, were saying, we guarantee you we're going to rush this out to you, which scared me to death. But it also is our food. When I talk about the rise of autoimmune disease and issues in America, especially, we are the sickest nation, certainly in the first world of the first world nations, and really around the world. Highest levels of autoimmune disease, highest levels of neurological disorders, highest levels of drug and pharmaceutical use. So clearly, the pharmaceutical industries are not making us healthier, and they happen to own all of our media and a good chunk of our government agencies. But what I loved, even in watching that sort of montage of your work, that what really brought you to sort of stepping outside of mainstream thinking was just food in hospitals. Why are we feeding people such crap when we're trying to heal them? Just quickly, is there a difference between big food, big ag, big pharma?
In many ways, they're not. They're very similar. In fact, actually, Kelly Brownell, a professor from Yale of psychology, and a lot of work on obesity and trying to understand what was driving it in the United States, actually wrote a great paper which people can look up. It's what, for me, it was very empowering, and it helped me with my advocacy and certainly highlighting the harms of excess sugar in the UK and also influencing a soda tax over there. And it's called How Big Food Played Dirty. Sorry, How Big Tobacco Played Dirty and Millions Died. How Similar is Big Food? And Del, you're absolutely right. If you look at the chronic disease pandemic across the world, but for the United States, for example, 6 out of 10 Americans have at least one chronic disease, whether it's heart disease, type 2 diabetes, cancer, high blood pressure, dementia, etc. I mean, that's a huge proportion of people who are suffering unnecessarily.
Yeah.
You've unfortunately, even pre-pandemic, lost 2 years off your life expectancy in the United States from 2014. You've got more and more people living in unhealthier lifestyles. And again, that's a lot of unnecessary suffering. So for me, trying to understand the root cause of that, when you look at food and the food system, you know, the Lancet Global of Disease reports, just to give people some perspective here in terms of the hierarchy of what's maybe most important. Poor diet now is responsible for more disease and death globally than physical inactivity, smoking, and alcohol combined.
Wow.
So if you're going to fix healthcare, at the forefront of that means fixing the food. And, you know, I started my campaigning well over 10 years ago on the issue of the fact that having an interest in food and how it was related to heart disease, I was trying to make sense of the fact that, you know, how did we allow our hospitals to become a branding opportunity for the junk food industry? 75% of the food purchased in hospitals in the UK, I suspect, not dissimilar in the US, is ultra-processed junk food, Del. So how can we be, as doctors, healthcare professionals, advocating for improving people's health, yet we are selling sickness on the hospital grounds? And that has been the result of Big Food's amazing success of making their ultra-processed junk foods available to anyone, anywhere, at any time, including even bed-bound patients in hospitals, Del, that have had heart attacks that can't leave the bed for more than 24 hours, so for at least 24 hours, where there are contracts with hospitals where they have to be taken to the bedside in trolleys, you know, sugary drinks, sodas, potato chips, candies. There are contracts that were created to make sure that happened. And then at the same time, we're trying to educate the public on healthy diets. So you can see there's a big conflict there.
Amazing. Dr. Aseem Malhotra, I know you have a lot to do. You're going to be in the States. This is a really important conference and some really big, awesome voices. Dr. Drew Pinsky, also someone that's taken his television career, put it on the line. Of course, we all know Robert Kennedy Jr. that's been fighting for transparency and science in almost every way of life. And Dr. Vandana Shiva, I mean, just a brilliant voice for the world. It's a great lineup. October 28th, 2023. I want to thank you for taking the time to join us today, but really especially for your clarity. It's so beautiful when not only do we see as a doctor and a scientist, someone that's, you know, willing to speak so openly, but is so absolutely incredible at it, Dr. Aseem Malhotra. You're a courageous leader in this very important time. It's just an honor to know you.
Likewise, Del. Thank you so much.
All right, take care. I'll see you soon. Make sure you don't miss out on that event. San Jose, look, you have so many friends in California. Drag them out. It's close. Hey, come for a ride with me. Come listen to some of the great voices that have studied these things. They're putting it all on the line. These are the types of events that are going to change people's lives, including your own.